new team of researchers is confirming that the best time for pregnant women to get their COVID-19 vaccine is as soon as possible. Hospitals have been experiencing a spike in COVID in pregnant women in recent months. COVID-19 is especially dangerous for pregnant women. The Centers for Disease Control and Prevention is warning women to get vaccinated right away if they are or if they plan to be pregnant. Joining me is Dr. Elizabeth Cappelletti, a board-certified obstetrician gynecologist. And Doc, you deal with this issue professionally, but you also deal with it personally. Tell me your story.
So yeah, I am a huge fan of the vaccine. And in fact, I was so excited when St. Joe's got the vaccine last December. In fact, I was lucky to get my vaccine on December 20th, one of the first people in the first wave. And at the time I was 15 weeks pregnant. Of course, pregnant women were excluded from the trials on the vaccine. There were no immediate concerns about the vaccine in pregnancy. And I felt personally that if I could prevent myself from getting COVID and being really ill in the ICU while I was pregnant, but more so if I could give some immunity to my baby, then that was absolutely worth any theoretical issue with the vaccine. So I didn't really have any qualms about it. I ran down onto the first floor of St. Joe's right by Java Joe's and got that vaccine as soon as I could.
You didn't have any fears though? Any concerns?
No, I did not. Some of my colleagues were pregnant as well, and we kind of all discussed it and we all got the vaccine. And I had no issues with the vaccine either. In my heart of hearts, I thought, okay, if I get this vaccine and I mount an immune response, that immunity will go to the baby. And then also with breastfeeding, that will help my baby as well. And so I did get the vaccine and then went on to have a healthy baby girl in May with no problems.
Congratulations.
Thank you. Unfortunately, she got COVID at 4 months of age.
Oh my gosh. What were the symptoms?
So minimal, a very minimal fever. And then she had some sniffles and a cough. And so I took her in to get checked. And when they told me she had COVID, I couldn't believe it. Because of course we're very careful, but she has a big sister and she's in daycare and you can't prevent all exposures. Fortunately, she was better almost the next day. And I really chalk that up to the fact that I had that immunity from my vaccine and I was breastfeeding her at the time, still am, but was then too. And I then got COVID because I was unable to isolate from her. So I was not surprised that I had a breakthrough infection because you can't isolate from a 4-month-old baby. We successfully prevented my husband and my 4-year-old from getting COVID by isolating. So that was challenging, but worth it because I didn't want them to be ill. I had mild symptoms like a cold and was not hospitalized, not in the ICU, anything like that. I was also lucky to get the monoclonal antibodies from St. Joe's and felt better almost in the next day after getting those. So I was very, very lucky to get that.
And of course, you attribute your very mild case of COVID to having been vaccinated.
Absolutely. Absolutely. And when I tested positive, I wasn't surprised. And I thought, okay, I am not going to die from this. I'm not going to be in the ICU. I'm not going to get a horrible pneumonia because I had the vaccine, which is exactly what happened.
Were you also boosted at that point or not yet?
I was not. I was scheduled to get my booster the day my daughter got COVID. And that was because the booster recommendations had just come out when this happened in the end of September, which booster was being recommended for healthcare providers. So I had already scheduled my appointment to get my booster, but then my daughter got COVID and then I got COVID. And so I actually just got my booster yesterday because I'm now 90 days out from my monoclonal antibodies because you have to wait for 90 days. But as literally on day 91, I ran into my office to get the third shot.
Dr. Cappelletti, what do you think are some of the lessons from all the things you just told me?
First of all, I am so grateful to have gotten the vaccine and so grateful that my daughter and I had such mild cases and had, no serious outcomes. She and I both didn't have any sequelae from long COVID or any problems. Which I think the vaccine, has shown that there are going to be breakthrough infections, but those patients are not sick. They're not in the ICU, et cetera. I'll tell you from my personal experience that the patients I've admitted with COVID-19 to the OB unit, the ones that are ill are the ones that are not vaccinated, which is so sad. And I think that there is a lot of vaccine hesitancy, and I talk about it to my patients all day long about my own story, but also my clear recommendation to get both the COVID vaccine and the flu vaccine. And there's just hesitance. We have a poster in our office from the CDC that says that if you have COVID in pregnancy, you're at 70% increased risk of dying, but only 31% of people who are pregnant are vaccinated. So it's such a dichotomy that I wish we could fix. And so my lessons, I'm so grateful to have gotten the vaccine, and I have no regrets because I really think that it helped both of us. And I just really wish that more of our patients would get it as well, so that we could prevent these increased risk of maternal and fetal poor outcomes.
What do you say right now to pregnant women who are listening to us talk right now who are not vaccinated?
Please get the vaccine for you and for your baby and your other children, protecting those who can't get the vaccine. For example, those kids who are younger than 5 at this point. I cannot recommend it enough. And all of our governing bodies recommend it too. You know, Society of Maternal Fetal Medicine, American College of Obstetrics and Gynecology, the CDC. They have done registries that have not shown that there's complications for pregnancy from the vaccine, but yet we know that there are complications from actually getting COVID. So it's really important.
If a pregnant woman gets COVID, of course, there's the risk of the baby being born prematurely, carries significant risk
Yes.
to the babies,
Yes.
potentially leading to long-term intellectual and developmental disabilities.
Mhm.
What are some of the other risks or some of the concerns?
There is a thought that it might increase risk of stillbirth as well. And then for the mom, like I said, increased risk of death and severe disease, ICU admission, et cetera, which is terrifying.
So you're affiliated with St. Joseph Mercy Health System, born at St.
Correct.
Joe's yourself.
Yes. I was born at St. Joe's. And now I work at St. Joe's and deliver babies at St. Joe's, which is a huge honor. And I was lucky to be a patient at St. Joe's, delivering both my girls at St. Joe's. My first daughter was in the NICU at St. Joe's and had a wonderful experience there. My second daughter did not need the NICU, but had excellent pediatric care. And they're also pediatric patients at IHA and St. Joe's too. So we're lucky to be part of that family.
So when you're there as a doctor now and you're talking to your patients and they say they don't do vaccines or they don't trust the vaccine or they don't believe in getting the vaccine, what do you say?
Well, I try and figure out what might be the hesitance about it. And I overarchingly say, I absolutely recommend this for you and your baby. And then I tell them my own story too, that I got the vaccine when we had no data, I was like 15 weeks pregnant. And like I said, I ran to get that vaccine. And just my experience now that we're almost 2 years into this pandemic, that the patients who are not vaccinated are the ones that are sick. And that's terrifying to be in the hospital, short of breath with COVID pneumonia while you're pregnant. It's terrifying.
And how's your beautiful baby now?
Doing great. She's now 7 months.
So if you left us with one bottom line message, what is it?
Please get vaccinated. Anybody who's eligible and boosted.
And I'll add to that, the U.S. Centers for Disease Control and Prevention recommends COVID-19 vaccinations for pregnant women.
Absolutely.
Dr. Elizabeth Cappelletti, thank you so much and happy 2022.
Thank you. You too.
Talk to you soon.